Ear infection in children. An ear infection is an inflammation of the middle ear, usually caused by bacteria, that occurs when fluid builds up behind the eardrum. The scientific name for an ear infection is otitis media, OM. Anyone can get an ear infection, but children get them more often than adults. 5 out of 6 children will have at least one ear infection by their third birthday. In fact, ear infections are the most common reason parents bring their child to a doctor. There are 3 main types of ear infections. Each has a different combination of symptoms. 1. Acute otitis media (AOM) is the most common ear infection. Parts of the middle ear are infected and swollen, and fluid is trapped behind the eardrum. This causes pain in the ear, commonly called an earache. Your child might also have a fever. 2. Otitis media with effusion (OME) sometimes happens after an ear infection has run its course and fluid stays trapped behind the eardrum. A child with OME may have no symptoms, but a doctor will be able to see the fluid behind the eardrum with a special instrument. 3. Chronic otitis media with effusions (COME) happens when fluid remains in the middle ear for a long time or returns over and over again even though there is no infection. COME makes it harder for children to find new infections and also can affect their hearing. Most ear infections happen to children before they learn how to talk. If your child isn't old enough to say, "My ear hurts," here are a few things to look for. 1. Tonguing or pulling at the ears. 2. Fussiness and crying. 3. Trouble sleeping. 4. Fever, especially in infants and younger children. 5. Fluid raining from the ear. 6. Lumpiness or problems with balance. 7. Trouble hearing or responding to quiet sounds. Causes. An ear infection usually is caused by bacteria and often begins after a child had a sore throat, cold, or other upper respiratory infections. Risk. There are several reasons why children are more likely than adults to get ear infections. 1. Eustachian tears are smaller and more level in children than they are in adults. This makes it difficult for fluid to drain out of the ear, even under normal conditions. 2. A dry immune system isn't as effective as an adult's because it's still developing. This makes it harder for children to fight infections. 3. Adenoid. As part of the immune system, the adenoids respond to bacteria passing through the nose and mouth. Sometimes bacteria get trapped in the adenoids, causing a chronic infection that can then pass on to the eustachian tubes in the middle ear. Diagnosis. If an ear infection seems likely, the simplest way for a doctor to tell is to use a electric instrument called an otoscope to look at the eardrum. A pressed, bulging eardrum indicates an infection. Treatment. If your doctor prescribes an antibiotic, it's important to make sure your child takes it exactly as prescribed and for the full amount of time. Even though your child may seem better in a few days, the infection still hasn't completely cleared from the ear. Stopping the medicine too soon could allow the infection to come back. It's also important to return for your child's follow-up visits so that the doctor can check if the infection is gone. Once the infection clears, clearance may still remain in the middle ear, but usually disappears within 3 to 6 weeks. Prevention. Currently, the best way to prevent ear infections is to reduce the risk factors associated with them. Here are some things you might want to do to lower your child's risk for ear infections. 1. Vaccinate your child against the flu. Make sure your child gets the influenza or flu vaccine every year. 2. Wash hands frequently. Washing hands prevents the spread of germs and can help keep your child from catching a cold or the flu. 3. Avoid exposing your baby to cigarette smoke. Studies have shown that babies who are around smokers have more ear infections. 4. Never put your baby down for a nap or for the night with a bottle. 5. Don't allow sick children to spend time together as much as possible. Thank you very much.